Welcome to our Gerontology Conference, brought to you by Alicia, Catherine, Holland, Neil, and Shauna. Autonomy and Advocacy for the Elderly. Autonomy is the concept that each person has a right to make independent choices and decisions, while advocacy refers to loyalty and support of the needs and interests of others. Elderly patients are at risk of losing autonomy and a decreased quality of life as they need more assistance with self-care, activities of daily living, and psychosocial problems. Our increasingly complex healthcare system often calls for advocacy to assist these patients and their families to find resources and information in order to make appropriate decisions. With the establishment of legislatures in the last few decades, such as the Patient Self-Determination Act, this vulnerable population has legal support to predetermine their preference for care in order to maintain autonomy regarding their health and quality of life, especially when incapacitated. However, it is not uncommon for patient wishes and advance directives to be ignored or not completely followed by medical providers or families. A nurse is in the best position to open communication with elderly patients to establish preference of care in order to better advocate for their wishes when the need arises. Even further, it leads to the question, how do we as nurses help to make their choices one that are valued? Maintaining autonomy in various ways. If you are in an accident or become terminally ill and are no longer able to talk about your wishes, who will advocate for you? Advocacy and autonomy. Advocacy is when nurses or any other healthcare individuals protect the health and safety of their clients with communication and promotion of care. Autonomy is the right to make independent choices and decisions. Patient wishes and advance directives allow older adults to have say in their life and their care when they do not physically have the voice or cognitive ability to do so. When an older adult does not have these abilities to say what they want, as a nurse, it is our job to advocate for them. Independence increases the quality of life. The aging process, as we all know, with the psychological and physiological changes, can reduce functional capabilities. A person's ability to be independent is an important factor affecting their quality of life. Functional independence helps increase autonomy. Risk factors for decreasing independence include advanced age, chronic illness, difficulty walking, fear of falling, and mental illness. Advanced care planning is making decisions about desired care when one becomes unable to speak for themselves. Decisions are based off of personal values, beliefs, preferences, and discussions with family and providers. What advanced care planning includes is receiving information on the different life-sustaining measures, options, and treatments available, choosing the treatments and end-of-life care that is fitting to your own values, beliefs, and preferences, deciding what treatment options you do not wish to receive, and completing the required legal documents. Benefits of advanced care planning. Advanced care planning has been proven to decrease the stress and anxiety associated with hospitalization and death because all of the decisions are made by an individual, removing the added stress and conflicting wishes for the family. Satisfaction has been proven to increase because family and patients are receiving patient-selected care while hospitalized. Family members have increased feelings of positivity related to death because the individual's wishes were respected throughout the hospitalization. An individual is maintaining autonomy by completing advanced care planning, by making their decisions for their health care even when they are unable to voice their decisions and wishes. Planning ahead, advanced directives, and patient autonomy. The Patient Self-Determination Act of 1990 It safeguards patient autonomy by protecting their right to refuse or accept a treatment even when they are incapacitated. And it provides legal backing for advance directives, which include do not resuscitate and do not intubate orders, living wills, and power of attorney, which are designating an agent when patient is deemed incapable. Advance directives and planning ahead can spare terminally ill patients from suffering, free family members of making decisions during times of emotional stress, maintain autonomy for the patient during the end-of-life process, and despite all these benefits, only 20% of elderly Americans have advance directives in place. Late completion of an advance directive is considered less than 3 months before death, and it is associated with aggressive treatments that cause unnecessary pain and suffering to the patient. This is possibly due to hurried conversation during times of emotional stress that focuses on aggressive care instead of an in-depth planning that promotes patient preference and autonomy. Early conversations and quality planning with patients and their families provide the medical team with clear instructions regarding goals of care during the end of life. Different ways to plan for the future. There are multiple options that patients are able to complete and be a part of to make sure their wishes go respected. Advance directives, durable power of attorney for health care, living wills, appointment of healthcare representation, and life-prolonging procedure declarations are all legal documents stating the level of care someone wishes to receive or appointing another individual to make these decisions when they are not able to. A code status is the overall level of care someone wishes to receive when they go into cardiac or respiratory arrest, and they are typically do not resuscitate, DNR, do not intubate, DNI, or partial code, which you can choose which life-saving measures you would like to have performed on you. 5 Wishes is an organization that helps individuals to make specific decisions at this time of their life, including appointing an individual to help make decisions or choosing an individual to make the decisions for them when they are unable to, the kind of treatment a person wishes to have, how comfortable they wish to be in the end stages of life, and how they wish to be treated by others, and the words they wish to leave with their loved ones. 5 Wishes is currently legal in 42 states, and it eases the process of making these decisions. Allowing natural death is a more detailed order that focuses mainly on allowing natural death and providing comfort measures. POLST, Physician Orders for Life-Sustaining Treatment, is a detailed list of instructions for emergency personnel when an individual is still at home and emergency personnel has been contacted. These instructions include an individual's wishes for CPR, medical interventions, medication, and nutrition. Nurses as a role model. Nurses can be advocates, and it is our role as nurses to safeguard patient autonomy and promote self-determination in patients that are competent. It is nurses' role to serve as an intermediary between patients and their families or significant others and healthcare providers to assure their wishes are being met. It is our job to empower our patients and help them remain independent as much as possible, and it is our job to promote acceptance of the informed choice of the patient. Nurses as role models can set the example as an advocate by educating patients and their families, which enables them to know their rights, be fully informed, and have access to all the benefits and resources they are entitled to. Advocate for patient wishes with the interdisciplinary team and family even when the patient is not present or capable. and to maintain the status of safe care for the patient at all times. Common areas when a patient needs an advocate are during end-of-life decisions, making informed consent, patient information disclosure, cultural and ethnic diversity, completing advance directives, and when family disapproves of the patient's wishes. How can nurses improve autonomy? The best thing nurses can do is initiate the conversation. Most people have not had these conversations with their family, loved ones, and providers, and it is evident by only 26.3% of people having advance directives. Many individuals do not have advance directives, and this is a direct relation to lack of awareness and education. Individuals who are non-white, have decreased education, and minimal chronic illnesses are more likely to not have completed advance directives. Nurses should educate themselves and help provide training for others. Nurses should educate and support patient rights and allow them to be informed. And nurses should never assume and always seek clarification and ask the patient for information to assure that we are on the same page and we understand what the patient is talking about. Educate patients in all settings of care and in all age groups. It is never too early to have conversations and to make people aware of all of the options that they have available to them. Being preventive so family and patients know what to talk about and expect. Encourage patients and families to talk to each other. It's best that patients and families talk to each other prior to it being an emergency and having to make these decisions on the spot. And providing awareness. Here is a list of our references that our information was gathered from in presenting this project. And I hope you guys enjoyed. Thank you for viewing our Gerontology Conference.